Hi, everyone. Thank you so much for joining us today. Good morning, good afternoon, good evening, wherever you're joining at. If you can drop in the chat, whether you're on Facebook or LinkedIn, whatever platform you're on, just drop us a little note to let us know where you're listening in from today. I'm listening in and calling you from Charlotte, North Carolina. Super excited to have you here today. We are going to talk today about creating the ideal resume for your international hiring process. Resumes can be tricky. Everybody's looking for something different. And so we want to give you our best tips and advice to creating a resume that will help you be successful in your job search. So let's go ahead and get started. We'll move to the next slide. My name is Kelsi Robinson. I'm our senior recruiter. Like I said, I am located here in our Charlotte office. I've been with Worldwide for a little over 2 years now. If you guys join our webinars, you've probably seen me a couple different times because I love getting on here and talking to you. And then I'm going to let my co-webinar presenter introduce herself.
Hi, my name is Jessiana Lockeye. I am the campus recruiter here at Worldwide. I previously worked in the Rexburg office, and I currently work from home here in Utah, Salt Lake City. And I've been working with Worldwide. It'll be going on 2 years soon. So I'm excited to talk to you guys about resumes today.
Awesome. All right, let's go to the next slide. So one, we want to explain to you the importance of a well-crafted resume, of course. We also want to talk through some key components of an effective nursing resume. So what you should have on there, what you shouldn't have on there. And then we want to give you some tips for tailoring your resume for U.S. health systems. So we want to make sure that you have all the things you need on your resume to really put your best foot forward when you interview with an employer here in the U.S. Next slide.
Awesome. So I'm going to talk a little bit about the importance of a strong resume. So statistics kind of have shown when an interviewer or when just an employee in general looks at a resume, they usually take about 10 seconds to kind of sometimes think in their mind whether they like the resume or not. So it's very important that you make a first good impression to potential employers. It's also very important that on a resume, you highlight your qualifications and experience. A resume is a little bit more different than a CV. A CV, you can add 2 pages, 3 pages, is more than 1 page where you add all of your experience kind of from your schooling from the beginning all the way till now. Whereas a resume is a little different. It's only 1 page. So that is why, especially for nurses, that it's very important to highlight your main qualifications and experience and specifically note your nursing experience. I'm sure you guys have worked other jobs previously, but what's important for a resume for a nurse, or especially when you're interviewing with these employers, is to add all of your experience that you have as a nurse, especially because these employers will be calculating your pay according to your years of your RN experience. So that's very important. And another thing that is also important to add is we want to make sure that a strong, good resume sets you apart from other candidates. So it's important to add all of your relevant experience and also qualifications or specific licensure information that might kind of set you apart from other candidates. So next slide. Okay, so I'm going to talk a little bit about the resume format. Kind of how I mentioned earlier, an employer, we want to make sure that you have all of your information, and the way that your resume is formatted is clear and easy to read. So like I said, that when usually when an employer views your resume, they just kind of skim it through and then they start reading it. So we want to make sure that it's organized, it's clear to read. The font, you could, for example, use either Arial or Calibri. Times New Roman is also really good. Just fonts that are easy to read. We don't want anything cursive or any weird fonts that would make it difficult for the interviewer or the employer to see. Another thing that is very important when it comes to your resume format is you want it to look neat. So if you look at this example here, it's very neat, very concise. You can kind of see, and you kind of can see, everything is where it needs to be, and just very easy. So we also want to make sure that it is a consistent format. So if you look at this example, you're going to see kind of the bolding. You're going to see that the headers, so like education, licensure, contact information, those are bolded, where we can easily see them and kind of look down. We can then know what information we're looking at. We also want to make sure that your resume is consistent with the italics and the bullet points. So for example, if something is italicized when it comes to your work, your position where you're working, we want to make sure that is consistent, that all of your experience met, like all of your jobs that you've previously had, mentioned that as well. So just very consistent format. And we also want to make sure that you are including, again, as mentioned previously, all of your nursing experience, because your RN experience is what is going to be used to be calculated, to calculate your pay. And we want to make sure that your employers see all of your nursing experience and what you kind of have to offer. Next slide.
All right, so now we're going to talk through the different parts of a resume, all the different things that you need to add to your resume. We're going to talk through. If you have questions as we go, please drop those in the chat and we'll be answering questions at the end. Also, if you want this particular resume format, we are going to drop a link to that in the chat as well, so you can use this format when you're updating your resume. So one of the most important things to have on your resume is, of course, contact information. This is how your recruiter is going to be able to get a hold of you. So if you're missing parts of your contact information, your recruiter is not going to be able to reach out to you effectively. There's also some pieces of contact information that are not common in the US, and we'll talk about that as well. The things that you should include are your full name, a professional email address, whether you use a work email address or a personal email address, make sure that it's a professional email address. Also your phone number, including your country code. This is how your recruiter is going to be able to get a hold of you and follow up with you, as well as your email address. If you use LinkedIn, which is a very popular platform across the world for job searching, you can also include a link to that as well. But if you don't use LinkedIn, it's okay. You don't have to have it on there. And then optionally, including your home address. You don't have to put the street or the street number, but at least the city and the country that you live in. This is one way for us to be able to see when is a good time to call you, because we're working in different time zones. We don't want to call you in the middle of the night. And so if you can add your city and your country to your resume, that helps your recruiter to be able to see when is a good time to reach out to you. Now, there's some things that you should not include on your resume. The US is very particular about personal information being on resumes. There are a lot of protections for workers here in the US. And so some things are too personal to be on a resume and you should leave off. One of these things is pictures. You don't need to have a picture on your resume. The next is religion. It is not appropriate to put your religion on your US resume. Same with your marital status and your age and date of birth. Those are things that your employer and your recruiter don't need to know about you to make a hiring decision. And also family information. You don't need to put information about your parents or your spouse or your children on your resume. Now, of course, if you sign an offer with us and you begin the immigration process, we will ask about these things for your legal paperwork. But for your resume that's going to be presented to employers, we don't need to have that listed on your resume. And then the last thing that we don't need to see is your gender. We don't need to see that as well. If you have questions about things you should or shouldn't add, you can always ask your recruiter. They'll tell you, yeah, that's a great thing to add, or no, maybe leave that off of your resume. But this is a great starting point to give you an idea of what type of contact information should be listed. Next slide. The next thing that you're going to have on your resume, probably at the top. So you'll have your name at the top, and then next you want to have what's called a professional summary. And this is usually 2 to 3 sentences, just briefly introducing yourself, talking about your key qualifications and experiences. So, like the units that you have experience in. And sometimes you can tailor it to a specific job or specific opportunity. So we have an example here on the screen, and I'll read it to you guys because it's a little small. But you could write something along these lines. Qualified nurse with 11 years of clinical experience, 5 years at a Magnet JCI accredited hospital with a main specialty focus in the critical care area, certified BSN with CCRN, TNCC, and ACLS certification. So you can see that first we talk about your clinical experience. How many years do you have? Then we talk about the specific experience you have. So maybe right now you're working in ED or med surg or dialysis. You're going to list that. And then you're going to follow it up with your specific certifications. And this was most likely that you have your BSN and that you've passed the US NCLEX exam. This can really be tailored to you. So write what is pertains to you. Make sure it's not more than 2 or 3 sentences, and make sure it's at the top of your resume. This gives both your recruiter and your employer to read just a little bit about you. You don't want to put personal information here. You don't need to talk about your family or your hobbies. Keep this specific to your work experience. All right, next slide.
Okay, so another thing that we're going to mention is licenses and certifications. Those are very important to kind of add on your resume as a nurse. So it's very important to kind of remember that we want to include all relevant nursing licenses and certifications and the year that it was received. That's very important. So, for example, if you have your visa screen, if you've taken IELTS, TOEFL, or PTE exam, those are kind of things that you can add on there. If you've taken and passed your RN NCLEX exam, that's something else that you would want to add. And then also mention any international qualifications. So maybe any certifications or anything that you might have received in your home country. That's also valuable information for the employer to see that you've won different awards in your home country as well. And then also, it's just very important to highlight any US specific certifications. So as mentioned, your NCLEX are an exam, and also just to add the date that it was received. Also, I know sometimes with international candidates, there are various US certifications that your hospital might have done. That's another thing that you can add on your resume. That would be really good to see if you worked at a hospital that maybe has US certifications or works with a US hospital. That's something else that would be really good and kind of may help you stand out in comparison to other candidates to add. Next slide. Okay, so we're also going to talk about the educational background. So it's very important to list degrees in reverse chronological order, so from oldest to newest, which would be, I would, in adding maybe your BSN degree first, and then if you've done any other, like a master's degree or anything like that, to go ahead and mention that afterwards. You want to make sure you include your institution name, the name of your institution, the location, and the date that you graduated. So the year that you started, and then the end date. You don't have to add a month or date. That's totally fine. Just a year is sufficient for the employer to kind of see when you started and when you completed your schooling. Also, to mention any relevant coursework or honors. So let's say you went to a school that and you completed some relevant coursework maybe to the position. You can go ahead and briefly mention those courses in that education section. Again, anything that might be related. Maybe there's a coursework or something related to that's internationally well known, or US employer related. You could go ahead and add that. And then also any honors too. That's another that's something, another key component that would make you stand out to add any honors information there. Next slide.
So now we're going to talk about your professional experience, work experience, which of course is one of the most important things you can list on your resume. Like Jessiana mentioned earlier, most of our employers, when they're calculating your salary, it's based on how much experience you have. And so we recommend adding all of your RN experience to your resume. So if you have more experience than will fit on one page, it's okay for your resume to be more than one page if it's to include all of your RN experience. You're going to list your jobs in reverse chronological order. And what this means is that your most recent job or your current job is going to be at the top of your resume, and then your next job before that, and then before that. So make sure to list all of the jobs. You're going to include several things. The job title. So you can put staff nurse or charge nurse, but specifically put the unit that you work in. So staff nurse in ED or staff nurse in OR. Make sure to list that way. You're going to put your employer, so the name of the hospital that you're working in, the location. So if you're in the UK or in Pakistan or South Africa, you're going to put the location, the city and country of where you're working. And then really important to have is the dates of employment. So what month and year did you start working there? And then what month and year did you end working there? Now, if you're still working there, you can put either the words to date or present or current. Any of those are fine. So let's say you started your job in January of 2018 and you still work there. You would write January 2018 with a hyphen and then present or current. And that allows us to see that when you started and that you're still currently working in that role. And then you'll want to have some bullet points to describe key accomplishments and achievements and responsibilities. One important thing to list is your nurse to patient ratio. So make sure you put that there. If you float to other units, you can list that as well. And then the types of patients and cases that you handle. So talking about the types of patients that you see on a regular basis is super important. So make sure that you have all of your RN experience listed. If you don't have all your experience listed, you might not get the full salary amount that you could have if you listed all of your RN experience. So make sure you list all of your RN experience and most importantly, your current RN experience. Next slide. So next up, you can highlight your skills. This is usually a small section, maybe on the side or at the bottom of your resume. And there's a few things that we want to talk about here. The first are your clinical skills. So your patient care, medication administration, those types of things. Your technical skills. So what types of software or equipment that you have. Soft skills like communication or teamwork or adaptability. What are some areas that you're really strong in with your team or at your current hospital? And then specific equipment that you used, like if you use EKG machines, it's super important to put that on there because that will open up some other opportunities, or the type of charting that you use. So if you use paper or electric charting, and you can put the type of charting that you used. This section of your resume does not have to be very long, just a few bullet points to show some specific skills that are relevant to your current experience. Next slide. And then there's some additional sections, and these are optional if you have some other relevant sections that you want to talk about. This could be volunteer experience or professional affiliations. If you're a member of any nursing associations, it's great to add these as well. If you speak multiple languages other than like your home language and English, you can add this as well. Sometimes it's great for hospitals to see that you speak an additional language because maybe they have a patient population that would benefit from a nurse that can speak their language. And then any awards or honors that you have. Now, we don't want you to attach any certificates or awards to your resume, like the documents, but if you have them, you can list them out on your resume, and that's totally okay. Next slide.
Okay, so just a few common mistakes that you might want to avoid. and this is something that I also kind of deal with as well, that I try to make sure on my resume that I, fix, but typos or any grammatical errors. So what kind of helps me is just once you complete your resume, just to look through it again, maybe read it out loud too. Sometimes that helps you in kind of noticing the errors. Any inconsistent formatting. So as mentioned earlier, we want to make sure that the format is all the same and consistent. So if something is bolded in one section, make sure in the next section that same thing continuously is bolded. We want to make sure that we are not including any irrelevant information. So, as mentioned before, too, we want to make sure we have all of your relevant RN experience, maybe previous experience you might have had at another job that's not related to nursing. You don't need to add in the resume that you're specifically using for an RN position. Overloading with too much detail. So as Kelsi kind of mentioned, you want to make sure that in your bullet points, you add specific, maybe machinery, specific skill set that you have used that will kind of make you stand out to the employer for your position that you're interviewing for, as well as make sure that your resume is unique to you. You have unique experiences, a unique skill set, various certifications and things that you have received and done. Make sure to add that and make it tailored and unique to you. Next slide. And then another thing that is super important is kind of reviewing your resume and getting feedback. As I mentioned a little bit earlier, you can seek input from your mentors, colleagues, or professional services. So it's super important and helpful after you read it yourself and look at your resume and try to make sure that grammar and everything is good. It's always nice to maybe reach out to a mentor, a colleague, a friend, or even use a professional service online. There's many to kind of review your resume and give any feedback. Sometimes when we create our own resumes, we don't realize the things that can be changed or can be better. So it's always nice to have somebody else look at it. Another way is using online tools for resume reviews. There's many online tools that you can use, many services. If you go on Google, there's many that'll pop up that you can look at and use that are free. You can also go on YouTube. There's a lot of great videos too that can kind of help you out too. And then just make sure that you revise and refine based on feedback too. So your first resume that you kind of create, it's not going to be perfect. That's why it's super important that you review it yourself, as well as reach out to mentors and friends to kind of give you feedback and then tailor it according to what you feel is necessary. And then another thing as well is you can always ask your recruiter for input too, and also ask your recruiter when you send them your resume, just have them look at it and ask them if there's anything else that they feel that might need to be added for your next interview. Next slide.
All right, some final tips. And while I talk through these, if you have questions about the things that we've discussed today, maybe you have a question about your resume, or if you should add something specific or take it away, go ahead and ask those questions in our chat now, because we're going to open it up for questions here in just a moment. But lastly, just be honest and accurate on your resume. As you know, you're going to go through an intensive immigration process with our legal team. And so everything that's on your resume needs to be 100% accurate, because this can affect your decisions and your choices in the future. Like we said, keep it concise and focused. Make sure it's about your nursing career, your experience. You don't really need to add hobbies or things about your family to your resume. We want it focused on your nursing career. And then proofread it multiple times. So make sure that you've gone over it, you've reviewed it. Like Jessiana mentioned, it's important to have your resume look unique to you. Sometimes we get friends that apply because you and your friend want to go to the same place, and your resumes might look exactly the same. And then the employer's like, that's weird. These people have the same exact resume. So make sure your resume is specific to you so that you can make sure to put your best foot forward. Next slide. All right, so we're going to take a few questions from the chat. Most of the questions I see here are about the types of nurses that we're looking for currently. So I'm not going to respond to every specific question, but I am going to tell you that we're currently hiring for RNs who have taken and passed their NCLEX exam. We are looking for RNs that have current bedside experience. If you don't have current bedside experience or you're going to get back into bedside, you can always send us your application, but you won't be eligible to interview until you have that current bedside experience. If you have past experience, that's fantastic. We also just want to make sure that you're currently working in a bedside nursing role. We do hire medical laboratory technicians. You do have to have your BSN in medical laboratory sciences and your ASCPI certification to be eligible. Right now, we don't have any openings for nurse aides specifically, but you're always welcome to apply and be on our wait list. There is just a long waiting period for that. The one other question that I saw in the chat was about relocation assistance when you get here to the US. And almost all of our employers provide the first 30 days of housing for you. So that's typically in a hotel or apartment near to the hospital that you're working for. And we have a fantastic relocation team that are super excited to work with you through that process. I see a question from Daryl about not having NCLEX. Like I mentioned, we're looking for nurses that have passed their NCLEX. We don't have openings right now for nurses, for nurse aide roles or positions without NCLEX. So NCLEX is required to work as an RN in the US. Let's see. If anyone else has a question, go ahead and add it here in the chat because we're going to wrap up today. If you have a question that you didn't have a chance to ask, please reach out to our recruiter. You can reach out on our Facebook page. We have lots of team members that would love to assist you in your process. Next slide. Don't forget to like us on Facebook for immigration updates and new positions. And always reach out to our team if there's anything else that we can assist you with. And I think that is all the updates that we have for you today. Thank you so much for joining us. Go take some time, work on your resume, make sure to put your best foot forward to your employers. And our team looks forward to assisting you as we move